This program examines podiatric medical conditions and the procedures involved with treating them. Due to their graphic nature, viewer discretion is advised.
I remember my mom telling me that I have a double toe. She told me that at a young age. I've never gone to see a doctor about my foot. It scares me to not know what's going on.
Anxiety's building up.
Yeah.
I've seen a lot of things, throughout my career, but I really don't think I've seen something like this before.
Oh my goodness, I can't wait to see what it's gonna look like.
Yeah. That's your first time seeing these X-rays?
This is my first time seeing the X-rays, and
You too?
I'm just like,
yeah.
Hey.
So we're gonna take a look at it. Here is your foot. It's a double toe.
No way.
It's a little bone off to the side. So what was happening is this little bone grew, your toenail and everything just like another toe.
Right.
All right? So essentially it is another toe that was coming off the inside of your foot.
Wow.
Right? It's definitely congenital.
So wait, an extra toe started to form
On the inside.
on the inside.
On the inside. Usually they happen on the outside.
On the outside,
Yeah, it's called polydactyly. So, when you first look at Kiara, you would think that, she has macrodactyly. Macrodactyly is an enlarged big toe. But in Kiara's case, she actually has a little bone off to the side. It's not connected to the main bone. So what I feel like we can do is make an incision basically right down through the toenail because we want to salvage this good part, right? The bad part of the nail is going to be gone and then getting that bone out. And then it's really just skin work there. My main area of concern is making this toe nice and slim, just like this one.
Okay.
Okay? And you're happy and confident.
Okay.
Does that sound good?
Great, yes.
Kiara, I'm going to see you on your surgery day.
Okay, great.
Okay, if you have any more questions, you let me know.
I have a sixth toe growing inside my toe. It's super crazy.
So Kiara's a really interesting case. She has a really big toe. Her body, for whatever reason, wanted to grow another toe on the inside of her foot.
So I'm just gonna draw a line here. And then that's what we want our toe to look like after, so we're good. Let's get started.
So what I'm gonna need to do is make an incision right down the middle of her toe, right where that line is. Then I'm gonna take off the nail.
So that was her nail. Now let's go in and get that bone.
Can you feel bone under there?
Yeah.
Okay.
I'm on it right now.
Are you?
Yeah.
It's bigger than I thought it was gonna be.
Yeah. When looking at an X-ray, it looks like there's a clear demarcation where there's like a nice joint. But that bone is attached in a certain way to where I just can't get through it with, a blade. Trying to pop through right now, and it's not doing it. Do you have anything with not as sharp a tip?
There we go. Beautiful. You're under it.
5, 4. All right. Goodbye, extra bone.
There it is.
So that's it. So it's exactly what, was just drawn here. And that side is gone.
That's actually perfect.
So our job right now is to really go in, get everything out of there, make sure this is nice and clean. Something back here.
I'm feeling around, I'm putting my finger in there, and something just felt wrong.
Feel this right here.
Something felt rough. It didn't feel like it, belonged there.
Interesting.
Yeah.
Is this?
I don't know. Something just wasn't right.
Oh, wow.
There was a bone here, and it was more on the plantar surface. The plantar surface was on the bottom of the foot. So it was kind of hiding underneath this toe. That's why we take an x-ray, we look at it, and now we'll go in and find it, and we'll get it out. All right, so I found this other piece of bone. It was definitely hiding underneath the tip of her toe. We got it out. Way bigger than I thought. Wow.
That last piece of bone was actually going under the tip of Kiara's toe. So that would have caused her a lot of pain in the future. Basically, it'd be like every single time you took a step, you'd be walking on a pebble, and the pebble would have been her own bone.
Cool. Feel anything? This looks nice and clean. Good job. You can see once that flaps back down, she now has a normal looking big toe. All right, so now we'll just close her up.
Yep.
Yeah. All right, so she's all sutured up. The result right now is great. All of this bone is completely out. It really doesn't even look like a bone was there. That was our goal, and Kiara's gonna be very happy.
Great.
How are you feeling?
Thank you for taking care of me. I'm
It's
feeling
okay.
good.
I'm more excited to show you your toe.
Oh my God.
I'm just gonna show you your x-rays here. So your whole toe is perfectly flapped over,
Yeah?
just like your right foot.
Oh my God.
When you see this toe, you can even already see that it's more narrow.
Great,
okay?
wow.
Now, with Kiara's skin incision exactly how it is, it's up to the healing process.
You and me are good.
Thank you.
All right, you're welcome, Kiara. Nice meeting you. Thank you so much. See you guys later.
Bye.
Bye.
Today, I'm here to see Dr. Schaefer for my follow-up. He's going to take my bandages off to see what my toe looks like.
Kiara, what's up?
How are you?
I'm well, how are you?
Good, good.
I have been excited for this meeting.
I know, so have I.
Good. So let's just take this one off so we
Sure.
can compare. And then we'll remove this pretty sandal. Very good. Look at you with the crisscross Band-Aid. Okay, I see you. Wow. Kiara, that looks
Nice.
awesome.
Amazing.
You know, obviously you still have a little healing to go here,
Yeah.
but that looks exactly the way that I want it to look right now.
100%.
I'm very, very happy with this.
So quarantine is over for the most part. You know, people are still staying at home if they don't need to go anywhere. But, you know, as a doctor, my office is open and we're gonna hopefully, you know, get back to where we were treating patients with all of their foot and ankle problems. Today we have a very special patient, Sebastian. He's got a very, very, very rare disorder. And I'm talking to specialists from all over the world that have dealt with this condition in order to treat this appropriately. It's called epidermodysplasia verruciformis. And what this condition does is to form large growths on his feet that are very, very painful and continue to grow. His immune system doesn't have the checkpoint to suppress the growths on his feet. There's been a case of this that was in the media. The man is called the Tree Man of Indonesia. I've been looking up his case specifically in terms of how to go about treating Sebastian. The Tree Man of Indonesia, he died at the age of 45 due to complications associated with a weaker immune system. So there is a fear that over time, this condition could kill Sebastian.
So, how are you doing?
Nervous, very nervous. They hurt so bad. I guess my biggest fear about seeking treatment would just be it growing back the same amount, the same quickness. And it's absolutely a huge fear of mine if this disease could kill me one day.
All right, hello, Sebastian.
Hi.
And I'm Desiree. Yes, nice to meet you.
It's great to meet you.
It's great to meet you in person.
Absolutely.
So tell me how this whole condition has sort of affected like your life. Like
Well, the pain in my feet, it keeps me up all hours of the night. I'm sure I drive her crazy with it.
yeah.
I would like him just to go to sleep with me at night, but that
I'm not
doesn't,
even able to-
that doesn't
yeah.
always happen.
Okay.
And it's just emotionally draining.
Well, I can understand that. And then we're gonna determine like how we can make your life way more manageable. With that said, let's see these feet.
Okay.
I've come across really bad growths before, like really bad, but I have never seen a case like Sebastian's before, ever. Those feet are shocking. When I took his socks off, the smell was pretty intense. Other than smelling a dead body, I think that this was probably one of the worst smells that I've experienced. Spreading his toes out to see how much of his toes were encased in the soft tissue was pretty extraordinary. Does this hurt when I'm doing this?
Yeah, very painful. Ooh.
What does it feel like?
Just like a tight pressure, yeah, stinging, kinda.
Okay. How sensitive is it? Is it hurting when I push?
Yeah, that one causes me a lot of pain.
Yeah, okay. There is a toe underneath there.
Yeah. I haven't seen him in years.
So I believe that you have a very rare disorder,
Yeah.
epidermodysplasia verruciformis.
It's so cool to hear you put a name to it, because everyone just always calls it warts.
Sebastian has a gene mutation, and so his immune system is weak enough to allow these growths to grow all over his body. I do know that this is a very serious and very, very rare condition that you have. It's something that can be managed but not cured.
Okay.
It's not going to get better without surgical intervention. With that said, we're gonna take these off.
Okay.
Okay,
Great.
we're gonna be very specific in how deep we go.
Okay.
And I'm gonna take off as many as I can, making this a functional foot.
Oh,
All right?
that's a miracle. To hear her say that I actually have a chance at some type of normal life is just absolutely insane.
So will he be able to keep his toes?
Oh yeah, I think I can keep the toes. I'm gonna clean it up really, really good, okay? That's half the battle. The other battle is I have to find what these soft tissue growths are. Okay. They have a presentation that is wart-like, and it's usually associated with the human papillomavirus, but everyone is different based on their specific gene mutation. So whether it's a wart, whether it's a tumor, whether it's something else, we really don't know unless we remove it and send it to pathology, you know? So until that pathology report comes back, I still cannot rule out cancer. There's a lot at stake here with a weaker immune system. Usually you don't die from the soft tissue masses, but you die from other things like cancer or other type of viruses that you are susceptible to. The other challenge with this is I don't want to remove all of this and leave your skin exposed because your immune system is compromised. So what I'm going to do is replace what I've taken with a really cool skin graft. Removing these soft tissue lesions could in fact make his immune system worse, and then susceptibility to complications and infection is going to be a problem. So there is a fear that this condition could kill Sebastian. I want you to be aware that there could be complications like infection or an amputation. So I just want to make sure that we're all on the same page. We all have realistic expectations. I'm going to try my very best, but that is a possibility. Sebastian, unfortunately, can't fly back out to see me because of the coronavirus. We had to definitely rule out cancer. So we had to get a biopsy, we had to get an MRI, both of which came back negative. He did send me new updated pictures, so let's see how he did. Okay. This is the left foot, but this looks way better, like way better. I guess he just got out of the bathtub here. He's a little wet. And then let's see the right foot. There was like growth all over here, and this is looking a lot better too. So I'm gonna go ahead and send him a text to just let him know that he needs to just keep up the good work.
So I'm here at Dr. Ebonie's office, and I'm terrified.
Thank you. Thanks.
And I'm ready to get this thing off of my foot.
Hello.
Hi.
How are
Hi,
you?
I'm good, I'm good.
Good to see you.
Good to see you as well.
Lauren, nice to meet you. Well, tell me from the beginning,
Okay.
what's going on with the foot?
Honestly, it's like a giant bulbous mushroom that's popping out of my foot.
Okay.
It's really gross. And there was like a tiny bump at first, so I went and saw my doctor then. And they tried to freeze it off.
When you had it frozen off before, did someone take a knife and kind of debride, or they just kind of froze it around?
They just froze the whole
area.
thing. Yeah.
Okay. Well, let's take a look and see what we find.
Perfect.
Perfect. I do have to say I love your socks.
Thank you. Thank you.
Eggs and bacon. I love it. Very interesting. So I actually have no idea what this thing is. Okay. For the majority of it, it did feel pretty soft, like skin. It did have this like calcification or possibly even like bone that I could feel that was very hard underneath there. Basically, I do not know what this is.
Could it be extraterrestrial in nature?
Yes, you are an alien.
I always suspected it.
I knew it. It's more adhered on this side than it is on the other side.
Yeah, it used to be connected all the way around.
Anytime you're dealing with something like this, you want to make sure that it's not infiltrating any other vital structures. So we did get an MRI to know how deep it goes. It could be a cancerous form of tissue. It very well could be an extra toe. But in order to rule it out, you have to take it out. So this is the day it's gonna leave.
I know.
So
I feel kind of bad. Like, I feel like I should apologize to it or something.
Aw, poor thing. We're here to take off his skin tag on the bottom of his left foot. I'm calling it a skin tag because I don't exactly know what it is. We're gonna send this to pathology. I know you asked if you could have it.
Oh. I've always threatened to my sister and nieces that if I got it back, I would cook it up in a skillet and serve it to them. They're not too amused by that. No worries.
But
I'd rather...
I have to send it to see what it is.
Yeah.
You know.
I think that's more important.
I think that's more important too.
Yeah.
We'll take pictures of it.
Okay.
Okay. I'll see you back there. Okay.
All right, sounds good.
Okay. So right now, I'm just planning my surgical site incision. Paul's surgery is going to entail creating a elliptical incision around that soft tissue skin tag, removing it. The bottom of the foot has very thick skin, and it's not as pliable as the skin on the top. So basically trying to reapproximate that area for healing is a big concern of mine. Okay, incision. So I'm cutting off Paul's soft tissue lesion. I'm going slowly with blunt dissection, making sure that I'm not gonna sever any blood supply, nerve supply that it might be associated with. I don't believe anything is a stalk or anything going out of it, so. There's nothing there that I can see that would be a source of a possibility for regrowth. So that's good news for him. There's no vessels associated with this guy, no weird stalk. I actually have no idea what this thing is. So we've got to send it to pathology. The pathology report will tell us exactly what it is. Yeah, so it took up quite a large surface area of his foot where that lesion was. Sewing up the bottom of a patient's foot is always a bit of a challenge. It's gonna be hard to reapproximate this skin primarily, but I'm gonna try and close as much as I can. All right. I think that Paul is gonna be very happy. He might miss his little friend, but I think, I think overall he'll be more comfortable walking around. So today's the day I'm gonna see Paul for his follow-up. So we didn't really know what Paul's skin tag was. Basically, I removed it. Hopefully, he's healing really well, but we'll see.
We are here today to get the results from my biopsy, and I'm hoping that the biopsy comes back being cancer-free.
Hello, guys. Hi,
Hey.
Paul. How are
Hey.
you?
Good.
Hi. It's good to see you guys. Oh, man. So,
Yes.
I think we should see where we are.
Sure.
Ooh. Oh. This is lovely.
It's my color.
It matches you very well. Okay.
Yeah. We were sitting out on the porch the other day, and Lauren, I guess, got really bored and pulled out her polish, and
It was a great opportunity. They
Yeah.
look beautiful.
wasn't
I like
necessarily the color I would have gone with, but
Oh, yeah. You have a little bit more healing to do. There's a little scab up here. It looks like
okay.
it's healing really, really good. I'm happy with it. No more big old skin tag.
Can I look at it really quick?
Yeah,
before
you can
it-
go ahead.
Oh my God, it's so pink.
We sent in the skin tag to pathology. Whether or not it was cancerous, that was the biggest thing we wanted to rule out. The pathology report came back, everything's benign.
okay.
And actually there was no bone in there. Unfortunately,
bone?
I can't say it was a toe. It's just a benign skin tag.
I feel like I can take a breath of fresh air now that it's not cancer. I just feel really good now. Now we can just continue on and let
Get
this
on with
be
our
the past.
What's up, buddy?
Hey, how you doing, Doc?
I'm well, thank you. My name's Dr. Schaefer. Hello.
Hi, I'm Jennifer.
Jennifer, nice to meet you.
Nice to meet you.
So what's going on, man? What brings you in?
Just had these bubbles on the bottom of my feet. I don't know what they are.
Do they ever pop?
They don't pop. It feels soft.
Yeah.
Like, I don't know if there's fluid in there or if there's tissue. I don't really know what it is, but it's just like, it's painful. And I walk like I'm 90 years old. Even
You're not 90?
I'm not, I'm close.
Oh, okay.
I'm close,
Oh, wow.
I'm close.
Yeah.
Like in my early 20s, I had trauma to my feet. A buddy of mine fell off second story patio onto his head. I jumped after him to see if I could be a superhero and help him.
Save him, yeah.
And I landed concrete and I landed on my feet and I broke little bones in my feet. And that's when it all started in my early 20s.
You know, on the bottom of our feet, we have a band of fascia. It's called your plantar fascia. And the only thing that I can think is if you jumped down,
Right.
that plantar fascia fired and that rubber band might have ripped.
Okay.
You know, the little rips in the plantar
Yeah, that
fascia
makes
could have
sense.
ballooned out,
Yeah.
creating these like bubbles.
Okay.
You know, let's do this. Let me take a look. Wow. RJ has extremely large masses on the bottom of his feet. They're firm, they're thick, they're encompassing the whole, you know, ball of the foot. You know, I don't know exactly what they are right now, nor does he. Personally, I have never seen this before. All right, so it's really just the bottom of the foot. Yeah, and you can see here this huge one on your arch.
Mm-hmm.
There's even a little one here. Wow.
It's painful on the side where you're
Right.
pushing on the side of my toe there. Yeah, right there.
Yeah, this one looks gnarly.
It's so painful.
Let's see this one. They're kind of like maybe as hard as a tennis ball. Every step RJ takes, it's like that tennis ball is just grinding into the bottom of his foot. This one's large too.
That thing is the painful. That's the most
Yeah.
painful one right there. It's
Sweet murder.
extremely painful.
Yeah, no doubt. So I would say every step you take, that arch is probably absorbing all of that pressure and ripping, you know, in
Okay.
this ball area.
All right.
So you have one here in your arch, And then it looks like you have 1, 2, and 3. What you have is called a plantar fibroma.
Plantar fibromas are basically masses that occur along your plantar fascia. They can be caused due to trauma, like RJ jumping off a balcony after his friend. They can be genetic. It's called plantar fibromatosis, but it's one of the two, and it's treated the same way.
I haven't seen it as advanced as this. This requires surgery.
Right.
Okay? So it would be a plantar fibroma excision.
Okay.
Now, look, I can't just excise the whole bottom of your foot, or,
Right.
You wouldn't have a bottom of a foot. It just wouldn't be right. So what we're gonna do is we're gonna stage this.
Okay.
So what we need to do is focus on one foot at a time.
When you're looking at something like this, you're like, oh yeah, why don't you just go in there and remove every single mass? Well, in RJ's case, they're encompassing the whole part of his bottom of his foot. I mean, I would literally have to cut off the whole bottom of his foot to get rid of them. So it's gonna take multiple surgeries.
In my opinion, this arch one looks like something that I would wanna, strategically go after. The arch is kind of like our stabilizing force in our body. And this is an integral part to where I think we need to get that out sooner rather than later. I'll really shave them down nice and low, get to see exactly where that mass is, and then we'll have a little less stuff to remove so we're not completely destabilizing the bottom of your foot.
Yeah.
Yeah.
It sounds like the start I've been looking for.
So today's the day of RJ's surgery. He has a lot of plantar fibromas on his feet, and we're gonna do a staged process with this and remove one at a time.
I know you worry about me a lot. I've given you a lot of reasons to worry about me over the years, but this is not one of them. So don't worry about me.
What's up, RJ?
Hey, Doc, how you doing?
Well, how are you?
Hi, good.
See you.
How are you?
I'm ready. It's game time, right?
Right, sounds great.
You have any questions for me, buddy?
You an Eagles fan?
I'm a Birds fan, yeah.
All right. You're my guy.
Are
You're
you?
my guy.
You are? Yeah,
Oh,
good.
yeah,
Everything
absolutely.
Philly.
Absolutely.
Cool.
Cool.
I will talk to you after. You're gonna be groggy. You'll probably be hilarious.
No.
People after surgery say some wild stuff, and you're gonna be one of them, I
No,
guarantee it.
I won't be one of those
Yeah,
people.
I'm gonna record you.
Yeah, okay.
All right, bro?
Thanks, Dr.
All right,
Brad.
See ya. Yep, see you soon.
Appreciate it.
Go ahead on over your stomach.
Roll over my stomach on this?
Yeah.
I'm gonna be in my stomach the whole
Superman
time?
out.
I hope I wore clean underwear.
Oh my God.
The challenge with this plantar fibroma we're doing today is it's right in his arch, and that is the huge stabilizer of our foot. So we really want to make sure we do not destabilize that structure. Incision. I think I'll be sitting a ton once. Get in there. Let me go to town on this. Dude, this is huge.
I mean, that's a large part of his
Wow.
arch. That is his arch. What does it feel like? Oh, wow.
I know, right? It does kind of have the firmness of like a tennis ball, like the rubber, but you can also squeeze it. The goal right now is to really get this out in one big chunk. It's gonna be a lot of work.
This thing is massive.
Yeah, it's huge. Let me see what I can do. A really complicated part of this procedure is just when you're kind of searching around, you see some things that could be mass, but they could also be just his regular plantar fascia. 15, please.
There we go. That's like a root of
I know. Sometimes in surgery, people will wake up, and that's always a fear for people, is that you remember it, you feel pain, you wonder what the heck's going on in my body.
I haven't started yet.
Yeah, I'm working right now.
Yeah? How do I look?
You look good, RJ. In RJ's case, he was a chatterbox. He wanted to know how everything was going. I told him, and then he went back to bed. He was chilling. All right, I almost got it, Sarah.
All right. One piece, one piece.
Yeah, I got it.
Get the roots of this thing.
All right,
Wow. It looks like the pit of a peach.
Yeah.
It does, right? It's like the same size.
Hey, Doc.
What's up?
What's up, buddy?
How we doing?
Good to see
Nice
you.
to see you.
Good to see you.
Always bringing the vibes, right?
Today.
You bring the vibe.
Today
That's right, man,
is a very
always.
special vibe.
Let's see it.
Okay.
Let's take
Let's
a
unveil.
look. Yeah, cool.
Today, he's gonna tell me whether I've been a good boy or a bad boy.
As far as my healing process, I hope I don't make them mad.
Okay, cool.
Does it hurt when I flex it?
Not at all. Not at all.
It's good, feels great.
Yeah?
Yeah.
Awesome.
Okay.
Yeah, it feels great. I mean, that mesh was huge.
Awesome, babe. Good job.
Hi. How are you guys?
Fine.
I like your tie-dye.
Thank
The
you,
tie-dye
thank
mask. How are you feeling?
I feel good. I was a little nervous this morning. Poor baby.
Oh, no.
Got foot.
So tell me, like, when your foot started hurting.
It started this crossing over about 7 or 8 years ago.
Okay.
And of course, I have trouble walking long distances, you know. It's just curving over more and more.
Okay.
It's just really bothers me. My shoes, they don't fit right. They hurt any closed-toed shoes hurt my feet.
Mm-hmm.
And then I have to wear open-toed shoes, and then it's ugly to look at, and I'm self-conscious about it.
Well, let's see how I can help you.
Okay.
Well, let's take these socks off, okay? I'll start with this one. I see bunions that have the overlapping toe, but I've never seen it where it was like the whole first toe was touching the third toe. That was pretty impressive. So this is the main culprit. How's it feel when I'm doing this? Anything? Or not so much?
No, it actually, when it starts hurting, I kind of have to work it like that to help with
Help it feel better.
Mhm.
Okay. I'm moving Lisa's big toe up and down, and it actually does have some great mobility, nothing that's crunchy or arthritic in there. When I'm pressing on this, what's that feel like?
That doesn't hurt. Where it hurts is on the bottom of that, right in there.
Right in there?
Right in there.
I hear you. What about the second toe?
The second toe only hurts when I wear closed-toed shoes and it rubs on that
top area?
And it hurts bad.
You have what's called metatarsalgia, where the heads of the metatarsal bones are more plantar flexed than upright. Every step, you're putting more pressure right on the ball of your foot. So we definitely want to fix it here and then address the cosmetic portion a little bit, okay? Because this bone should be sitting on top of this metatarsal bone, which is right here. Let me go ahead and describe to you what I believe needs to happen. We're gonna fix your bunion, which is your biggest issue with this. And then we're gonna realign the joint and straighten out this toe joint.
Okay.
All right?
That sounds great.
Okay. Think it's gonna
mess up her tattoo?
I could probably miss your tattoo. That's a nice one.
Thank you. That's my mom. Well, she's been gone for 14 years now.
And yeah, I'm gonna try my best, okay, to not ruin the tattoo. All right.
Don't not do the best you can do.
To save the tattoo.
I would rather you fix the foot than
not save the tattoo. Got
Right.
it. And then the last thing we're gonna do is on this foot, we're gonna straighten out this toe here.
Great.
Just so you know, doing both feet at the same time is a little challenging because you don't really have one side to lean on.
Right.
You know?
Yeah.
So, but you've got some help.
Yes, ma'am.
So we're all gonna help you work it out.
The hardest part for me is I am not used to asking for help. And I'm having to ask for help now.
Today is the day of Lisa's surgery.
You're gonna take some nice, slow, deep breaths for me.
I'm doing both of Lisa's feet at one time. I start with the harder foot first and then end with a simpler note instead of the other way around, you know? So I'm making my incision. Basically, I'm trying to get right down to the metatarsal. The plan for Lisa is basically to rotate that first metatarsal bone into a better straight position. This is the unstable joint that we're dealing with when we have a bunion. It needs to be rotated back into a more stable position. I put like a little joystick in the metatarsal bone, and I'll have my assistant kind of rotate it a little bit while I put the positioner in place. There we go. Until on the x-ray, I see that the big toe joint is straight and in place. The metatarsal's in a good position. And now we're gonna put in the cut guide so we can actually make the bone cut. Ready? Then we can fuse the joint in a more stable and aligned position that corrects for the bunion. Basically, I'm gonna slide the cut guide off, and then I'll be able to take off the areas that I cut. That looks pretty good. So the next thing is fixing the second toe. After the big toe was completed, the next thing was we had to address the second toe and straighten it out and put an implant in there to make the hammer toe straight. Push that down. So I was trying to put the implant into Lisa's second toe, and oh no, it fell. It fell. The implant just kind of fell off the instrumentation to put it in and fell onto the floor. It's on the floor. It sucks. It really does, because you can't pick it up from the floor and blow it off. You can't do that. It would be breaking all kinds of sterility. Oh God, what do we have? Basically, you have to have a brand new sterile implant to put in. And these little implants are not cheap. I hate that I dropped the small one. No, this is fine. Thankfully, we have a backup, and then, my butterfingers, started to work, and we got the implant in. That looks pretty great. Lisa's left foot took a long time, but the right one went pretty easily. We fixed her hammer toe, and overall, I think Lisa's surgery went really well. That left foot made a huge transformation. The second toe no longer overlaps the first toe. It has a very straight position, and same with the second toe on the right foot. Alrighty, so we're done, guys. Lisa was a very pleasant surprise in the fact that she didn't have many surprises. I guess the biggest surprise was, oh man, I dropped the implant. I'm good.
Oh, hello, hello.
Hello, Lisa. How are you?
Oh, I'm doing good.
How do you feel?
I feel wonderful.
You're basically only 8 weeks out right now.
I tried to follow your orders,
So you didn't weight bear?
No,
at all.
Not until you told me to.
Excellent. I'm excited to take a look.
I know.
Okay. Both of her feet hurt. One foot was very bad and one foot was kind of bad. So we fixed them both. And I'm excited to see how she has been recovering. Looks good there.
It feels good. It doesn't hurt.
Good. This one's looking good too.
Yeah.
It doesn't cross over anymore.
I know, yay. When I look down and I see that my toes aren't crossed anymore, I'm just like, yes. And there's no pain. And I can walk.
My name is Carly DeBruzzo. I'm 25 years old. I'm a chef, and I really love that cooking can bring people together, and it's a great creative outlet. But it's hard for me to stand up and cook at home because after 15, 20 minutes, it feels like there's thousands of pins inside of my foot poking out all at the same time. I don't have most of those toes on the front of my foot. I just have my big toe. So when I look at my foot, I see something that I think is ugly. I was diagnosed with Proteus syndrome when I was around a year old. Proteus is having accelerated or strange growth. So they diagnosed it on the criteria of the kind of tumors that I was growing and the abnormal bone growth that I was having. I call this the shelf. It's on the bottom of my foot, and it's this big fat pad, and you can lift it up and see like ½ an inch under it. And that's like where the arch of my foot should be, but it's just full of jelly, the jelly shelf. I've had over 10 surgeries. My first one was when I was 9 months old. The doctors always said when I was growing up that once like puberty and stuff was done, that the tumors would stop growing and everything would be okay. But they're still growing.
Since I started training to be a doctor, easily quarantine was the longest time. I didn't operate, I didn't treat patients in an office, so that was crazy. I have a extremely challenging case coming up. I met Carly for the first time over a computer screen. Proteus syndrome, it's very rare.
I was born with this problem, so I don't know what it's like to have normal and pain-free feet.
Proteus syndrome is basically elephant man disease. The skin and the limbs can grow out of proportion and really grow in different directions, making every movement painful. I have seen this condition before. His name was Jeffrey Ortega. For his case, there was no surgical option that I could personally recommend. Proteus syndrome is actually so rare that only a few people in the world have it. So to me, I'm kind of thinking maybe it's macrodactyly, which is, the enlargement of possibly just one toe. But right now, this foot is a mystery to me. Hey, Carly.
Hi, how are you?
I'm well. How are you doing?
I'm good. It's nice
What's
to
up,
meet
buddy?
you in person.
I know, finally. How you doing, buddy? My name is Dr. Schaefer.
Mike.
Nice to meet you, Mike. I've been excited to see you. Honestly, my heart completely went out for you, and that's why I want to help you.
That would be great.
Right? Now, Proteus syndrome is so rare, right? So I'm interested on who diagnosed you with that, and why do you and the doctor think that it was or is Proteus syndrome?
I know it happened when I was really little, like
Right.
before I could talk. And it's because I started growing the lipomas, and it also affected the bone growth in my foot.
Why did they start amputating part of the foot?
So like my first operation, I was 9 months old.
Sure.
They took these two toes off because they were fused together,
Okay.
and they were as long as my baby foot was already. Yeah, so they took those off.
That's rough. I mean, there's no doubt about it. That's where I come in. That's why I want to make life pleasant again, right? So I'm examining Carly's foot, and it looks like a form of macrodactyly, which would be just a really large toe. But when I'm really feeling around, her foot is very squishy. There's clearly some tumor-type formation going on inside there. So there's definitely something different going on right now. All right, so I really just want to get a good idea of how you walk so I can help alleviate that pain that you're in. So Carly, if you don't mind, I'm going to have you walk down the hallway. I'm going to take a look.
Okay.
Okay, and if you could just walk right down the hall for me. Yep, you're doing great. There you go. Yeah, you're walking all on the outside of your foot. Watching Carly walk, it looks very painful because she has that mass basically all over her arch. Carly's big toe should have been a stabilizing factor while she's walking, but it's not doing anything right now. You can see that one of her calves and thighs is larger than the other. And, to me, that's signifying that there's possibly tumors in there, which would lead me to believe it's Proteus syndrome. There's a lot going on with your foot. I would tend to agree. It's definitely a form of Proteus syndrome, and it can be very hard to treat. And sometimes you do go down that rabbit hole by, doing amputations and removal of, soft tissue and all of these things. So, if you look here, like we were saying, this big toe, it's aligned, you can see all the bone formations. And then when you had your surgeries in the past on 2, 3, 4, 5, 2, 3, 4, 5, your fourth and your fifth, which are on the outside, they had the amputation of the toes, and these second and third metatarsals, they're fused together. That is part of what happens during Proteus syndrome. Bones can fuse, when they're amputated, they can grow more jagged, and then soft tissue grows. Proteus syndrome can be extremely debilitating.
I think that's part of why I've had over 10 surgeries.
Carly's been through so many surgeries before, and nothing has taken care of it. It's always just been, chasing that mass where they can sometimes just take one toe or two toes, a chunk of the mass here, a chunk of the mass there. Nothing has worked. And in her case, if you're just debulking it, it's just going to grow back and become more painful. Considering everything that I'm seeing, I feel that there's a surgical option for her, but Proteus syndrome is something you always have to be very cautious about. What I need to do is remove the whole mass so it doesn't grow back and become more painful. What my plan is, Carly, is to do a transmetatarsal amputation, and that is an amputation of the front of the foot.
That sounds aggressive.
Sounds aggressive, but this mass here and this big toe is what's really throwing your balance off, and it's making you miserable.
I'm at the point where I need an actual solution because I'm very, very tired of feeling like this every day, and I don't want to live my life like this.
So I just know that this is right, and I know this is going to make you happy, and that's the only thing that I care about.
Okay.
All right, so we'll do incision on the top of the foot, and then we'll remove the big toe area, and then we'll saw through each one of the bones. Then we're gonna flap this up, okay?
Okay.
So this fat pad here is gonna be shifted up, right?
Okay. I don't care if it looks pretty. I care if I can walk and if it's comfortable or not.
Right. My goal is to make this functional, and my goal is to make this the last surgery that you have to deal with. How do you feel about that, Carly?
I feel like I can give it one last, good try.
Good. I'll see you the day of surgery.
Okay.